All right, so this evening we are going to be looking at the in-betweens of cancer. Um, Cancer, as I have said, is no ordinary diagnosis. It's not one you want to really go to the doctor and hear that there is a possibility. It's instantaneous change that occurs that one experiences. So, just as a part of an introduction, the last 50 years has seen better understanding of the causes and the treatments of cancer. Stigma that was attached to cancer previously, it's no longer as obvious, it's no longer common, and people don't experience it as back in the early days, back in 50 years ago, which is pretty much a long time. And you can understand too why there would have been some level of stigma. That it doesn't mean that it is correct. No, that you should never stigmatize. But when something new is occurring, like when Ebola, we heard of Ebola and then we heard of COVID, and you know what happened with COVID. A lot of persons were stigmatized initially who contracted the condition in the early times back in 2020. Exactly. So a lot of persons experienced that. Cancer is no longer, it's drifting away, and I must just lean to as well, even HIV. People are more accepting of it because of the research and the treatments that have been instituted to help people, and different resources in terms of support groups and lobby groups and persons who will advocate for others. So there's a vast level of support in our community now. Early detection is key to cancer diagnosis or cancer, or just to know your status, just to know your state. Technology has really improved how we look at the prognosis of cancer in terms of you take into consideration the staging of the cancer, and you take into consideration the age, you take into consideration the treatment availability. You also have to take into consideration the demographic status in terms of financial status too. However, I must say that I've looked at some recent statistics, and uh, February 4th is World Cancer Day, and the Cancer Research Agency of Canada has been doing quite a bit of work to create uh, a leverage or an experience where people of different financial background, ethnicity, can experience and receive treatment and not worry about the whole financial cost of it. It's a big burden to the government, though, huge burden. So in every hour, in when we look at the statistics in Canada, every hour in 2023, there was an expected 27 Canadians that would have been diagnosed with cancer every hour, 27 Canadians. And this would incorporate cancers of all types, cancers of all types. 10 Canadians would have died as a result of cancer in 2023 every hour. The 27 diagnosed, 10 Canadians would have died of cancer every hour. Lung cancer continues to be the leading cause of death. However, the mortality rate, is declining at a very fast rate, at a very fast speed. Cancer, what is cancer? The cancer is a term that is used to describe largely a group of diseases that are characterized mainly by the malfunctioning of cells. Cells are minute and are foundational part of what makes us human. Cells are defined by their division. Like, for instance, look at, line up 4 balls together, one next to each other. That's how the cell is guided into replicating, to reproducing. However, in cancer cells, you find that picture now a mesh bag of balls together. They When there's a cancer cell, it begins to replicate and multiply at fast rate and in fashions that's unpredictable, resulting in malfunctioning of the body functions. Healthy cells are programmed to know what to do and when to do it, but the cancer cells do not have this programming. Therefore, they grow out of control. They also serve no physiological function. So it's like in the way it's growing, but there's no functionality coming from it. And that's when we begin to develop symptoms. These cells are referred to as neoplastic cells. When the cells begin to divide this rapid way, this disorganized, uncontrolled, in an uncontrolled fashion, we refer to it as a neoplastic process. Cancer is abnormal cells, whether it is benign, which is a growth that doesn't show cancer cells, but because of the rapid formation of it, it's an abnormal replication of the cells. You still refer to it as cancer, but it's benign, or a tumor, but it's benign. On the other hand, you have the metastatic version where it replicates and it spreads from its primary source, from where it starts to other parts of the body, whether it's localized or it goes through what we refer to as the lymphatic system. Our lymph system helps us to manage the fluid in our body. So it can move, cancer cells can break off and move through and go to other parts of the body. I must say, we can develop cancer at any age and any stage of life. We can develop cancer in any part of the body. If you were to look online on reported sources, sources that are reliable, you would see cancers to no end, from head to toe. There's so many. The cellular changes that occur, and this might sound sciencey, but you won't understand the concept of cancer without understanding the cellular changes that occur. The main focus is we mentioned previously that the cells are trained to replicate at a particular speed, and they do so in a sequence, in order, in an orderly fashion. No, there can be mutation of our genes which guide our cells to replicate. And this is one of the main theories relating to cancer formation. It could be an error that is spontaneous. You know, you do something every day, you do an activity every day. Let's say you bake every day, you bake muffins, but one day you just didn't follow the procedure for whatever reason. It was just an error that occurred, and you're like, oops, I put too much or I didn't put enough of a particular ingredient. It is something similar. It could also be influenced by external agents such as radiation from our cell towers. It can be from our environment, from the food that we consume, the water, the soil, or it could just be a gene that is referred to as an oncogene, meaning onco refers to cancer. The study of oncology is a study of cancer, or the science of oncology is a study of cancer. So it could be as a result of a gene that is cancerous. There are risks related to developing cancer and lifestyle, and we would have recognized that all these conditions that we look at, lifestyle is such a predominant, a profound aspect of these conditions, whether they are expressed in our lives or they're suppressed. Smoking is among the greatest risk of cancer. It can cause cancer of all sorts. Nutrition is another, and lack of exercise. No, it is believed that 30% of cancers are related to smoking and alcohol use, whilst about 18 to 20% of cancers are related to chronic infections, whether it is HIV infection, whether it's a leukemia type infection, a lymphoma type infection, a hepatitis B infection, like inflammation of your liver, or the human papilloma virus, a term that we hardly hear in our society. I remember in my earlier years of nursing, I would have heard HPV a lot, and even the introduction of vaccines starting to be given to girls at the age of 12 to help to prevent future development of uh, uterine cancer. But you hardly hear these terms anymore. I don't even know if ladies know where to go to have a pap test done. It's not as the information is not readily available. It's not. But I'm sure if you go online and you search deeply or speak with your family physician, you would be able to gather some information. Our resource persons like myself, we have linkages and network that we can ask somebody if we don't know. And then the other 30 to 35% of cancers are linked to unbalanced diet. Balanced diet. 20% approximately are linked to hormones, whether insufficient hormone or overactive hormones. 2% is related to occupational, like when we work in facilities that have asbestos and and someone develops a mesothelioma, like a cancer of the lung. So it's linked to occupation. You work in these factories that are old and the buildings are, non-functional use based on the material they made of. Pollution is another, and it accounts for 1%. We also have social and psychological factors that are linked to cancer. Stress. I often hear growing up that stress and cancer are no friends. I've come to see that in my career in the patients, the residents that I do offer care to. Yes, when they're overly stressed, it does create an atmosphere for infections because it reduces your immune system. And when the body is infectious, you're fighting a war, a constant battle. And that's exactly what cancer is if you're exposed to stress. You're adding to this rapid replication of the cells that are of no use. In our food, if we're exposed to sodium nitrate, and that is why when we're purchasing our food, we need to take to give an eye or to read carefully the ingredients and the preservatives. Viral infection or viral factors is another. I mentioned earlier the HPV virus. Also, herpes virus can be linked to cancer formation. Even chemotherapy that we use to treat cancer can be linked to cancer formation because you might be using chemicals to disrupt or to slow down or to eliminate cancer in one aspect of the human body, but that same chemo drug is killing the very normal cells and their activities and can cause cancer, another form of cancer. Now, I mentioned previously about February 4th being World Cancer Day. As an initiative, it is dedicated to reducing global cancer burden, not just in Canada, but across the world, because it focuses on research, and research is not limited to one aspect or jurisdiction. It is across the world that these researches are used for countries that are not able to carry out their independent research. This information gathered can be used in other populations. The focus is also on World Cancer Day, as I mentioned before, is to promote greater equity. And that we need in our society because no one would want a cancer diagnosis and everyone would desire treatment. And as such, it should be available to us. It should be accessible. Cancer, 24.7% remained the leading cause of death in Canada, according to the statistics in 2022, ahead of heart disease, which accounts for 17.2%. Many of us, if we were asked this question, what is the leading cause of death? We would perhaps lean to heart disease. I would probably, because you see them and they occur quite frequently, but cancer is leading. It is said, though, that the overall, when you look at cancers in research, you tend to look at what we call a 5-year net survival. No, that net survival, meaning you're diagnosed with cancer today. For the next 5 years, you're expected to survive. 64% of persons are expected to survive. And that is an improvement, vast improvement from back in the 1990s when only 55% of people would have been expected to survive at the 5th survival interval or 5th year. Significant progress is being observed in each province. I use the statistics in Canada, but wherever you are in the world, you can look at the cancer agency or foundation, and they will have statistics for that demographic area. Needless to say, the survival rate for cancer is typically higher if the cancer is detected at an earlier stage. So we are advocating for early detection through our proactive or optimistic approach. That means we get tested for males, your prostate. You go to the doctor, you get your digital rectal examination. It is an uncomfortable thing for many people because it makes you exposed, right? But we have to overcome the fact that we need to know what's happening in our body. And especially for younger males, it is really a touchy point, very sensitive. But I can tell you, having worked on research for the Caribbean, I was the lead data manager for 6 Caribbean islands through an $8 million research put on by Sick Kids Hospital. But this case, I was at a conference and this case happened to reach, and I'm speaking about prostate specifically. This case happened to reach, it wasn't linked to kids, but this gentleman was just 27 years old. 27 years old. And I will just step aside to say, and I can say this publicly because my cousin would have allowed me to say it. She was just 37 when she died. She was diagnosed, I think, 2 years earlier. Her mom was 42 when she died. She would have been diagnosed about 2 to 3 years. They both lived and died of breast cancer. So now it is said that, back in the days, you would say like 5-10 years ago, do not get tested with a mammogram unless you are over the age of 35 or 40. 35 was for women who had a family history, like a first-degree relative. A first-degree relative would be a mom, like a father, a mom. But now it is based on family history in general and just your proactivity to want to go to the doctor and get tested. I hope I'm not going too fast. All right. Healthy cells represent, I mentioned before, the smallest functional unit of our existence. And it's made up of different parts. The cell has different parts that have different functions. But and they are guided by genetic material that helps them to regulate. And we mentioned that previously. So I'll skip these 2 slides. For malignant tumor and benign tumor, I'll juxtapose them and give you a little bit of comparison. For malignant, which we said is the cancerous, can spread, it is dividing rapidly. So rate of growth is rapid, very fast. The nature of growth is that it invades the surrounding tissue. So this malignant tumor has the tendency to spread to other areas of the body, other organs, and vital organs too, usually to the lungs, the liver, the brain. The spread is via the bloodstream and the lymphatic system. I mentioned the lymphatic system previously. The bloodstream is another way that this tumor can spread. So imagine this, a tumor in the lung, a piece breaks off, whatever reason, deterioration of the body, disintegration, and it follows in the bloodstream to other parts of the body. In the lung, it would be called the primary, and wherever else it goes would be the secondary. The cell differentiation, no, when you go to the doctor and let's say they do a biopsy, it's common to diagnose cancer. They often looked at the differentiation. Differentiation is, can you make out the cells? Can you define them? Well, in the malignant cells or tumor, it's poorly differentiated as one would imagine. Even though these are science terms, you can think about it. You rarely can recognize. And it leads us to think of what is referred to as subtypes and why it is so difficult for cancer to treat. And for different individuals require different treatment. And that is why it is so complex. On the other hand, benign tumors are the opposite, slow growing. They stays in the same tissue. They don't spread and they appear very normal. We looked at some of the causes previously, or risk factors. We can look at sunlight. Sunlight is absolutely immaculately wonderful for our body. It is how our bones grow, our teeth. It's how we get our vitamin D. However, overexposure, excessive exposure can be linked to cancer of the skin, referred to as melanoma. Obesity, we did not mention that previously, is another cause of cancer, particularly uterine cancer and breast cancer. Radiation, we mentioned that, and viruses. There are different cells in the human body, and that is why cancer is versatile and occur anywhere in the body. The blood cells, we have the cells in the muscles, we have the nerve cells, bone cells, the cartilage cells, which are, the cartilage is that little, we used to call it when growing up, it appears transparent and it's grizzly and it's between the bones. So to prevent bones from rubbing together, you have cartilage between the bones. And then we have the liver cells. And no, hearing of the liver cells specifically, it could say kidney cells, but it says liver cells. Liver is an area, an organ of the body that cancer can be predominant. And once you have a liver cell diagnosis, the prognosis becomes poor because your liver is the hub. You would say you survive with your brain, yes, but the liver is the hub for all the functions in terms of your gastrointestinal, your food processing functions, and so forth, and getting rid of waste as well. Just skipping through a few of our slides because I am mindful of the time. Okay, the warning, cancer has 7 warning signals. These signals do not necessarily say yes, confirmatively that you have a cancer diagnosis, but they do lean toward cancer diagnosis if you're experiencing them. 1, changes in your bowel or bladder habits. So if you recognize that you used to defecate or pass your stool or your feces or go to the toilet and you pass it through your anus, which is your back end, and you do that, you have been doing that once every day consistently, and all of a sudden it's changing, and it's getting more prolonged, like every 2 days, every 3 days, every 4 days. That is something that warrants to look at. Bladder habits too. If you realize, as a male in particular, because when we think of like prostate cancer, you think of how the prostate lies around the urethra, which is a tract that the urine flows through. Once it enlarges, the prostate enlarges, it squishes that tract and the flow reduces. So you want to look at the flow of your urine as well. A sore that doesn't heal. And we looked at diabetes last week, and we mentioned about sores that don't heal, wounds that don't heal. This is a point of importance because it could mean a form of skin cancer as well. Unusual bleeding or discharge from any orifice, from any opening in the body. But I will make reference to females, especially because of the menstrual cycle that a woman experiences. You have to be mindful of the amount and how frequent, because we looked earlier at the causes of cancer and hormone was a part of it. And our menstrual cycle is influenced by hormone. Another thing we look at is discharge, which is in the same line. So we're at number 3, discharge. Discharge from the nipples, vaginal area, or so. Discharge from the penis, that can be linked to cancer. So we have to be observant, know our body, and be willing to take that first step. Thickening or lumps in the breast or elsewhere. Anywhere on your body you find like a cyst or a hard area, you want to check that out. Indigestion, not able to digest your food properly or difficulty in swallowing is another very, very prominent sign of cancer, usually gastric cancer or esophageal cancer, which is your esophagus. You might pronounce it a little bit different, which is a tube that runs from your mouth down to your stomach. Obvious changes in a wart or a mole is another sign. And the last one is a nagging cough or hoarseness. If you have a cough that is like lasting 3 months without having any link to colds or the common colds or so, you have to check it out. Or if it recurs rather, on a frequent basis. So having mentioned that, leads to cancers are named, like the base and the organ, it's named. So you can have a brain cancer, mouth cancer, you can have a throat cancer, esophageal cancer, stomach cancer, kidney cancer, liver, pancreas, abdominal, you can name it. But they are classified. So they are classified. When you hear the word omas, you think cancer, like carcinomas, which you could be a form of lung cancer could be classified as carcinomas. You have sarcomas, which would be classified as like melanoma, which is a skin cancer. You have lymphomas. We mentioned the lymphatic system previously. That would be categorized as a lymphoma. And then the blood-related cancers would be leukemias. I did mention previously about my linkage. I work with Sick Kids Hospital in the Caribbean as a lead data manager for 6.5 years. Even when I came to Canada initially, I was still their lead data manager, and I would have traveled back to Jamaica to assist on some of the projects. No, I must tell you that it came home to me in a very pronounced way when I saw babies, 0-year-old infant having colon cancer and having to do 3 operations before the age of 1. I saw many children with leukemias, and there are different types of leukemias. And the one that I remember very much is, we call it the AML, which is the myelogenous type. and it's deadly. It's deadly. But the lymphocytic type is not as deadly. But I've seen quite a few children that would have passed. And as a mother, you can imagine that would be touching. And the cost related. And their records were in volumes. Volume 1, 2, 3, 4, when you go to collect data. Because what our project focused on, what Sick Kids helped us in the Caribbean to do was to create databases, because the government, governments are blind when they do not have data. When they do not have data to look at, they are blind. So the aim of the project was to establish databases so that the government could see that, yes, this is real, and we need to put funds where necessary so that we can have proper diagnosis. And if we have proper diagnosis, then you can have appropriate treatments. What Sick Kids also helped the Caribbean, and this was like Jamaica. We had 2 sites in Jamaica, Trinidad, Barbados, St. Lucia. I don't remember all the others. I have 2 more. But what they helped us to do now is they had teleconferencing, and we were also able to transfer via FedEx our samples, like our biopsy samples, to Sick Kids Hospital, where they would do proper studies on it because they have the technology. So that was phenomenal. The project is still in existence, and we're happy about that. Partnership is, and that's why on February 4th, we say Canada looks at a global aspect when it comes on to cancer, not just themselves. I don't know why I want to single out pancreatic cancer, because recently someone called me and was inquiring about this form of cancer. Their father had recently received a diagnosis of cancer, And as a child of God, I first definitely give the hope. There is hope. But then you also have to give the staunch reality that pancreatic cancer is silent. And when we looked last week at diabetes and looked at the effects of the pancreas has on the body overall, the pancreatic cancer is one of the poorest prognoses you can ever imagine. And the survival rate is only 4%. What contributes to it? Diabetes, inflammation, high fat diet. No, I want to just look at a few tests, one for the male, one for the female. The breast examination that is often recommended to us, and this should be done for females once you reach puberty and beyond. You can lie flat on your back. If you put your left hand behind your neck or behind the back of your head, and then you use your opposite hand to, we say palpate, you touch around from the base of the breast in a circular motion towards the nipple with the fingers, but gentle, so that you can feel if there's any lumps. When you get to the nipple, you can actually squeeze to see if there's any discharge. You can pain as well, which is another prominent sign for cancer. You look at the shape of the nipple. Is it inverted? That means, is it retracting, turning inward, and so forth. And that's why it's important to know your body, look at your body. And for the males, testicular self-examination, where you hold your testicles while standing and you use your fingers, you grab them like this, not very, be gentle, yes. And you palpate the same way. You touch to see if there's any difference, if there's any hardness in it, if they're not movable, the fluid quality, the color, and so forth, and if there's any pain. Detecting cancer. So we mentioned those 2 tests that we can do. Otherwise, if we have the symptoms, like the 7 warning signs, or we are of an age or family history or exposed to, the doctors can do imageries like MRI, magnetic resonance imaging, or a CAT scan, which is a computerized axial tomography scan that can be used. We hear them a lot. MRI, CAT scan. These just form images of whatever is taking place in your body. We can also do a prosthetic ultrasound. We can do self-examinations. But with all that said, cancer, I mentioned previously, and I will say it again, is a complex problem. But we serve a great God. And I've seen persons who have recovered from cancer. It takes a drastic turn in our lifestyle to experience a better quality and higher quality life. But in healthcare, there is major problems with delivery of care, with public policy in terms of where they put resources. Like for instance, in the rural areas, we get way less resources than in like the city areas and so forth. So with that said, it's like you have greater hope if you were to be diagnosed with a cancer, for instance, and you're in the city. But then if many people are in the city, they're going to bombard the system. There's new hope in cancer treatment daily, daily. I'm telling you, daily. There are researchers. I've had the opportunity to go to Lyon in France back in 2019. And trust me, there were people from all over the world, every continent, and they were delivering presentations and researches on cancer. There's new hope. New Hope with chemotherapy. Daily, they're experiencing better use, better ways of delivering chemotherapy, better drugs, and continued research in cell mutation. Because if we recall at the beginning of this presentation, we would have heard that cell mutation is what triggers this rapid replication of the cells. There are also treatment options such as antibodies that are injected into the human body to help us to fight off some of these viruses which can link to cancer. And like, for instance, leukemia, I've seen where they have done bone marrow transplant and it was successful. And that's done over and over. That's one of the most common ones, bone marrow transplant. Not easy to find donors, but they have been successful. We have looked at chemotherapy and what it does in terms of killing good cells, killing bad cells, but in the process disrupts the normal cell division of the of normal cells, or the division that occurs in a normal cell, it disrupts it. And there are so many side effects of chemotherapy. One that stands out is hair loss, which we call in medicine alopecia. And thank goodness that there are ways to help maintain your body image by wearing like hair piece and so forth. And males can do procedures where you can fill out spots as well. And there are medications that can be administered to help with the regrowth of the hair. And for some, it usually regrows. For some, not really, and the quality changes. It gets a bit thinner. So we spoke about radiation. Radiation too is high risk, but very pertinent in reducing. A lot of times they use radiation before surgery to reduce the size of the whatever growth it is exactly. And then the operation becomes easier, less blood loss and less loss of body. I won't. Cancer is a disease, as we said, just to recap, cancer is a disease where the cell grows out of control and it invades and erodes and destroys normal tissue. How do we prevent it? And this is our final take. How do we prevent it? I do believe personally that a person who has a connection, a relationship with Christ, and researchers have shown this, will fear or will face any disease with a better front, better approach. You're more willing, more obedient, more willing to be compliant with your orders or your communication with your doctor. You're more willing to follow suit. You having a relationship with Christ in in a very peaceful way gives you calm and help you to be receptive to the outcome because you know he has your back and he has full control. And he has provided us, and I will say this until I die because it is law. God has given us the laws of health. And again, it might sound simplified, but it is a simplified approach because God wouldn't give us anything complex that we wouldn't be able to understand. Again, it goes back to our, if somebody could help me with the new start, I'm lost. Nutrition. What's the E for again? Exercise. Water. S is for sunshine. T is for temperance. How do we spell start? A is for air. R is for rest. Oh, great. Thank you, Pastor, because I forgot that one. And how could I forget that one? And I love to rest. And Sabbath, that's why Sabbath comes in. And T is for trusting God. And that's when I think of cancer, when I think of diabetes, hypertension, all the other illnesses, trusting God is like an ideal place to be. For more information, as I said, you can check the Cancer Society board in your jurisdiction. Do we have any question?
How oftentimes, well, I've seen over the years different church members, let's say. I remember one when I first came to the Maritimes, and she found out she had cancer. I forget which one it was. And immediately she went by way of super nutrition, rest, exercise, the whole 8 laws and whatever. And she was quite almost fanatical about it. And a few months later, she died.
Huh.
And so it makes you wonder, at times, um, is it, you look at these natural means and compare them with, let's say, chemotherapy, radiation, and so forth. Um, is there some way out where we can try to take an approach that avoids the chemotherapy or radiation, or is it just going to be a matter of chance or
That's a good question, Pastor. And I like your sense of reasoning behind it. And like you have seen church members with cancer, I have. I remember so plain, and I think Sister Heather Brown is on here. And this is information that would be able to be shared. It was shared among our church. We were very supportive of the individual, with a very prominent person in church. Like, oh, we were touched. So when she received the cancer diagnosis, breast cancer diagnosis, um, it hit us hard. It's like, how comes, immediately, as you have mentioned, she also took a naturopathic approach. What I must add is the naturopathic approach, what I observed was from a sanitarian run by Seventh-day Adventists back in Jamaica. And the quality of her last days were so peaceful. You would want to be around her. So, with that said, yes, you can avoid, but it's not for me to say it because then it comes on to it's from a communication, a relationship with you and your doctor. However, that said, a lot of times patients face doctors. We're so dependent on our clinical care professionals for information, we take everything and we run with it and we don't ask a question. I must say, sadly, our conventional doctors are not well versed with naturopathic medicine. You have to be trained in naturopathic medicine for you to be readily, or you're a Christian from, let's say, a Seventh day Adventist background, because we have the health message and we know and we have experienced it. I strongly believe that in a situation of such, you're going to have a very open dialogue with your doctor, understand the prognosis with your condition, get the options, and make a decision while trusting God.
So sometimes you would recommend chemotherapy or radiation. Other times it's,
Yes,
just as much as possible, go the natural path. But if it
along
comes
with,
to an extreme situation,
yeah. You know what? I find that natural medicine does not really conflict pharmaceutical medicine. You're telling me I'm getting a bit of sunlight. How is that going to, on a more regular basis, at times that are helpful for my body? How is that going to affect my drug? Yes, some drugs make you more sensitive. I'm telling you that I'm going to be drinking, make sure I drink my water, get my natural juices. Yes, some persons might, you will hear the information that it is against your drug. Again, that is between you and your doctor. But for the most part, I do not see it conflicting. And yes, chemotherapy from science is sometimes very important to shrink the tumor and to help that acute process. And that's why God has helped doctors and physicians that are trained in oncology, science, and other disciplines to help in this acute approach to get the body back on a path that we can, is like catch up, you know, but not to be dependent. The sad story is, yes, we do lose a number of persons. We looked earlier at the risk factors, stress. Trust me. How do you define stress? How do you know how much stress you have? How do you really know how it's contributing to the growth of your cancer? But that comes with trusting in God, saying He will provide for all my needs. And it's easier said than done. It doesn't mean that receiving a diagnosis of cancer, you're just going to be hunky dory. Oh, no, it's sad. It's a transition. You're going to have all the emotions possible. But then there's got to be a time that you get real, honestly, if you're going to fight. And we always hear fight the battle. I've been a part of um, what's that thing called? Omari, I don't know if you remember, Relay for Life. Relay for Life back in Jamaica, where the Cancer Society put on events every year. We camp out overnight, we get sponsors, and we get persons who have survived the fight with cancer to come and encourage others. And we also have a relay where candles are lit with paper bags and names of persons who have passed in it. So we honor, you know, or have a memorial of persons who have passed. But yes, we do have some who win, some who lost. That's just the sign.
yeah.
Yeah. Oh,
Thank
it's
you.
7:31. Thank you. Thank you for that question. If there's no other question, we can have a closing prayer by Sister Janice.
I
Any
have a
other
question
question?
for the
Yeah.
closing prayer. You
Yes,
mentioned
Sister Stacy.
inverted nipple. What if
Yeah.
the nipple has always been inverted from you're a young child?
Sister Stacy, I expected you to ask this
Something
question.
concerned about.
So, Sister Stacy, yes, I would not be particularly concerned, and that is why I made mention of knowing your body. So, if you have always had an inverted nipple, it's inverted. But if it's more inverted, it's progressively inverted, it's different, then I would be a concern. But you're right, our anatomy is of different variations. So, yeah.
Okay, thanks.
Thank you. Sister Janice.
Our dear Heavenly Father, we thank you so much for the information shared here this evening on this venue. We're thankful that you are our God. all these things are open to your divine survey. You understand it so much better than we ever can. And we know that you don't allow anything in our lives except that you intend to help us to grow by them. And so, Lord, again, we just want to commit ourselves to you and thank you for the knowledge we've gained here again tonight, and the ability we will have to make learned decisions. Help us, Father, to, before we even get to a cancer diagnosis, to take care of ourselves in the way that you've prescribed in your word. And please bless. And for those who are battling this disease, we ask for grace. We ask for wisdom and strength in the battle that they're facing too. And Lord, thank you again for all you do for us and will do until that day when you come to receive us unto yourself. And we thank you again in Jesus' name. Amen.
Amen.
Amen. That's right, Sister Janet. So even if we have lost a battle here on earth, there is greater hope. And that's just where my mindset is, And I've always thought to, if the worst comes to the worst, I just pray that at that time, and strength is harnessed to just come to the realization that God is in control. It's not always easy, and that's why we have friends who pray for us, friends who fellowship with us and support us.